Right. So today we'll be discussing about Chordoma. We have the last portions of your second chapter. Then we'll start a general chapter, your clinical pathology. Clinical pathology will start off with blood initially. Then we'll go into different bleeding time, clotting time. What are the components of blood? What blood grouping occurs? What is the chemistry of blood, and so on and so forth. Okay. Now, in any case, first of all, coming to Chordoma. Chordoma is a very slow growing malignant tumor. Okay, generally it arises from notochord. Notochord is a primitive axial skeleton. It is present in developing stages, and that notochord will eventually form a person's spine. Okay, so this is a slow growing tumor arising from notochord. Okay, notochord is the primitive axial structure through which you have development of spine. Now, as such, because it is developing from the axial skeleton, you will particularly have chordomas developing in the either in the sacral region or in the spheno-occipital region. ठीक है, वहां से develop होता है. Very infrequently or very rarely does affect vertebrae directly. Okay. Now, pathologically, the tumor itself will be very soft and it will be lobulated. You can see through the tumor, it will be translucent. You can somewhat see through the tumor, and it will be gelatinous with certain areas of hemorrhage. Okay, so the tumor itself is soft, lobulated, it has lobules, it will be translucent. Okay, um, gelatinous with areas of hemorrhage. Okay. Microscopically, if you look into the chordoma itself, you will see different types of cells. Those cells will be physalliforous. Physalliforous का मतलब है they will look like vacuoles. ठीक है? They'll have a vacuolated appearance. So chordoma has physalliforous cells which are surrounded by mucoid material, intracellular mucoid material. Okay, physalliforous cells are those cells that appear like vacuoles. They will, the literal means that literally it means that it will be bubble like. Okay, वो bubble like cells are vacuolated cells actually. Okay, now that is about our chordoma. Again, not a lot about it. So that completes your cartilage forming tumors. Then we have the last type of skeletal tumor, which is metastatic bone tumor. Now, metastatic bone tumor का मतलब है it has metastasized from some other location and come to your, infected your skeletal tissue where it is growing. Now, primarily this is more frequent than your main bone tumors. ठीक है, आपके जो primary bone tumors रहते हैं उससे ज़्यादा common है metastatic bone tumor occurring, and the metastasis itself will generally occur from carcinomas. It can be sarcomas as well sometimes. It can be carcinoma of breast, carcinoma of prostate, lung, kidney, several organs. It can be urinary bladder, testes, or melanoma. The tumor is basically, or cancer is occurring there initially, and it is metastasizing to your vertical skeletal muscle or skeletal bone. Okay. Now, it can occur as a single tumor, or they can be multiple tumors that are occurring either in one location or in single location. मतलब let's suppose it is coming from the kidney. ठीक है, यहाँ पर initially there is tumor, and this tumor is metastasizing, entering into your blood vessel, and it is moving around and it is reaching a single location. For example, it is affecting the person's femur. For example, it is affecting the person's femur. Now this is a single tumor that is affecting. Now दो वे में हो सकता है, ये एक ट्यूमर डायरेक्टली ऐसा आके खाली ये बोन को अफेक्ट कर सकता, or else it can be multiple tumors as well, in the sense that it is affecting femur, or it is along with affecting other bones as well. So femur, tibia, or it can occur in the humerus, or it can occur in your pelvic girdle, it can occur in any other bone that is present, maybe ribs. It can metastasize to any other location wherever blood is passing. ठीक है, जहाँ जहाँ सर्कुलेशन रहता है वहाँ that tumor cells can spread, and eventually they will go there, attach, and start proliferating. Generally, the bones that are involved, they will be spinal bones, pelvic bones, femur, skull, ribs, and humerus. ठीक है, bones that have tumors metastasized sized to them include a spine, pelvis, femur, skull, ribs, and humerus. Okay. All of these bones generally tend to get affected by metastatic bone tumors more commonly than others. Okay. So with that, we have completed your second chapter of pathology. Finally, one of the biggest chapters that is present for you in pathology. Whew, all lockdown yay chala. Well, any case, so that is done. We'll get into blood now. Third unit, clinical pathology. We'll start off with blood. I'll just go over the basics of blood in this class. Then we'll get into the details of different disorders of blood, how bleeding time, clotting time, blood grouping, all of that is done. Okay. So first of all, when we talk about blood, generally speaking, 8% of a person's body weight is made up of blood. Okay, on an average, women have around 4 to 5 liters of blood, whereas men have slightly higher. They will have 5 to 6 liters of blood. Technically, the range will vary between 4.5 to 5.5. Again, depending on textbook to textbook, gender to gender, and depending on race to race, different areas, this volume will slightly differ. As such, the pH of blood that you see is around 7.3 to 7.4. Okay, pH is around 7.3 to 7.4, sometimes 7.5 as well, 7.45, 7.5 hota. In women, the volume of blood is around 4 to 5 liters. In men, it is 5 to 6 liters, slightly variable. Okay. Now, as such, your blood itself, again, you know the jargon. The oxygenated blood is present in arteries, deoxygenated blood is present in veins, because of which arterial blood, if you cut open an artery, you will see that the blood inside the artery is much more brighter in color. It will be bright red, whereas blood in veins is what you call darker in color. When compared to arteries, it will be darker. This is because oxygen is higher in arteries. Okay, it is transporting oxygenated blood. Now, as such, the three main functions of your blood can be categorized into transport. There is protection and regulation. One second. Right. Audio. Okay. Now, first of all, coming to transport, what all does your blood transport? It will transport gases. Obviously, one of the main functions of blood is transporting oxygen to the tissues and transporting carbon dioxide away from the tissue to your lungs so that it can get exhaled. Then transporting nutrients for digest from digestive tract to the tissues, transporting waste products, metabolic end products from your tissues to get metabolized and to get excreted out of your body, either to your liver or to your kidney, so that it can excreted through bile or through urine. Hormones, okay, those are also transported through your specifically through the glands. Okay, from gland it will go to target tissue using the medium of blood. If we talk about the protective functions of blood, one of the biggest function will be that it has a very important role in inflammation itself. Without blood, you cannot have an inflammatory process. So your leukocytes, WBCs, that is your antibodies that are coming into picture, the platelet platelet and platelet factors that are coming into picture for causing clotting and all of that. All of them rely heavily on blood. Without blood they will not reach the target location. अगर रेगुलेशन की बात करें तो regulating pH, ठीक है, by regulating acids and bases, the amount of acid and base that is present in your in the blood, and by regulating or acid and base that is present in the body, and regulating the fluid amount that is in the body, also regulating temperature, ठीक है. Generally whenever blood flows through whichever part it flows through, it will make sure that it will warm up that region, and it will make sure that the body temperature is maintained at around 36 degrees centigrade, right? 36 to 37 degrees centigrade. If you take the blood itself, it will be at a slightly higher temperature, it will be 38. Okay. Now, as such, the blood itself is composed of two main components. You will have plasma, which is a clear extracellular fluid. So, if I take blood, I have two main components in this. We have plasma and we have formed elements. Okay. Plasma is that clear extracellular fluid that you have that gets extracted out of your blood after you centrifuge it. Formed elements will include your blood cells and platelets, and in other parts of your so fibrinogen, proteins, all of that that is coming into proteins. Other, I would say cells itself, red cell, platelets, any other type of WBCs, पूरे इसमें आते हैं. Formed cells में. So mainly three important types of cells that are present inside your blood: erythrocytes, RBCs, leukocytes, WBCs, and thrombocytes that are your platelets. Now there are various ways through which you can test for hemoglobin, one of the most important components of blood, specifically of red blood cell. Red blood cell में there is a certain amount of hemoglobin that is variable in between men and women. ठीक है. अगर आप अगेन एज पे डिफर होता, एंड इट विल आल्सो डिपेंड ऑन द क्या बोलते रेस ऑफ द पेशेंट, बट एज सच ऑन एन एवरेज अगर आप एक रेड ब्लड सेल लिए, फॉर एग्जांपल इफ यू टेक एन एवरेज मेल, the amount of hemoglobin that the person should have, or that male should have, is around 13 to 17 grams per deciliter. This value will vary a little bit depending on race and depending on gender. Again, तो अगर फीमेल्स में लिए तो 12 to 15 रहता ग्राम्स पर डीएल. दीज आर एवरेज वैल्यूज फॉर इंडियंस. ठीक है. देन अगर न्यूबॉर्न इन्फेंट रहा, newborn infants may generally it will be higher. The lower limit of a newborn infant's hemoglobin level will be around 15 grams per deciliter. Be careful, this is grams, okay, not mg. And if they generally reach the 3 month mark, it will decrease slightly. Okay, it will become 9 9 to 9.5 grams per deciliter, but eventually it will come up again. ठीक है. आप anemia चेक करने के लिए or any other what do you call problem for hemoglobin specific, let's suppose you want to measure hemoglobin level itself in the patient, there are several tests that you can perform, but there is one particular assessment that is very good for testing hemoglobin in a patient, that is called cyan hemoglobin test. So we have something called, one second, where is that? Yeah, it's called HICN test or HICN method or cyan hemoglobin test. ग्लोबिन टेस्ट. ठीक है, या साइन मेथेमोग्लोबिन मेथड भी बोलते हैं इसको. इसमें क्या करते हैं, यू टेक अ लिटिल बिट ऑफ ब्लड, ठीक है, इन अ टेस्ट ट्यूब, obviously with anticoagulant, and you'll make sure you have to add anticoagulant or else the blood will coagulate before you can perform any tests. Now you will take that blood and you will add potassium cyanate, and you will add ferricyanide. You can add potassium cyanide or ferricyanide, or you can add both of them. We'll take potassium cyanide for now. ठीक है. ये ऐड करके आप क्या करते हैं, the hemoglobin that is present in the sample, that gets converted into cyan methemoglobin. Once again, methemoglobin. नाउ दिस साइन मेथामोग्लोबिन में डिफरेंस क्या है, यहाँ पर it has attached with cyanide. The purpose of doing this is, once you have a certain amount of cyan methamoglobin formed inside your blood, the sample that you have taken, you will measure the absorbance of that particular sample. तो आप क्या करते हैं, you will put a small drop on a particular vertical slide, and you will प्रोजेक्ट लाइट ऑन टू दैट, ठीक है, 540 नैनोमीटर्स की लाइट आप प्रोजेक्ट करते, एंड यू विल सी द अब्जॉर्बेंस ऑफ लाइट इन दैट पर्टिकुलर ड्रॉप ऑफ ब्लड. That will indicate the concentration of cyanide that has been absorbed inside that drop. ये indirect method है through which you can find out hemoglobin. I will explain once again. You're taking one test tube, ठीक है, एक टेस्ट ट्यूब में you're taking a little bit of blood of the patient who you are trying to measure the hemoglobin for, ठीक है. आप उसमें क्या करते हैं, you will add a little bit of potassium cyanide. Okay, you will isolate a little bit of blood and you will add potassium cyanide. Sometimes you will also add ferricyanide. The intention is that you are trying to attach this cyanide, okay, to hemoglobin to form cyan methamoglobin. Once you have cyan methamoglobin, you will try to find out the amount of cyanide that is present in the blood. ठीक है, इट विल, आप एक पर्टिकुलर क्या बोलते हैं, फोटोमीटर यूज करते हैं, ठीक है, स्पेक्ट्रोफोटोमीटर बोलते हैं उसको, वो डिवाइस को, एंड यूजिंग दैट डिवाइस यू विल बी एबल टू सी द अब्जॉर्बेंस ऑफ लाइट ऑफ दैट cyan methamoglobin. So what I will do is I will take that on a particular slide and I will throw light on it, a very special type of light which has a wavelength of 540 nanometers. Now the amount of light that this cyan methamoglobin has absorbed, usko absorbance bolte, that will be measured, and depending on the amount of absorbance you can find out how much amount of hemoglobin must have been present. ठीक है, आप indirectly कर रहे, but by finding the amount of cyan methamoglobin I know that the absorbance will occur because of cyanide. If there is more cyanide there will be more absorbance. More absorbance means that साइनाइड ज्यादा हुआ था, एंड साइनाइड ज्यादा हुआ बोले तो हीमोग्लोबिन ज्यादा था. Until and unless there is enough amount of hemoglobin, the, see how much amount of hemoglobin is there, that much amount of cyanide will bind. If there is low amount of hemoglobin, low amount of cyan methamoglobin is formed. If there is no high amount of hemoglobin, high amount of cyan methamoglobin is formed, because of which absorbance will be high. ठीक है, that is an indirect way through which you can find out how much amount of hemoglobin the person has. This method is the best available method for several reasons. It is a lot more stable compared to other methods, and there is very little chance of sulfa hemoglobin being formed. Okay. Most of the hemoglobin gets converted into cyan methamoglobin. Only a little bit of sulfa hemoglobin that is present in the blood, that does not get converted. You can refer it very easily. You can put it against a standard and refer it very easily, and you can perform a large number of samples at the same time while performing this test. Okay, that is one of the reasons. Those are some of the reasons why you perform HICN test. Okay, I hope you understood the test. कैसा जा रहा है? ठीक है, indirectly you are trying to measure hemoglobin by measuring the amount of cyanide that is present in the blood. ठीक है, by adding KCN or by adding ferricyanide. Now, there are a few conditions in which there will be variation in the amount of hemoglobin. Okay, it can be physical exercise. If there is strenuous physical exercise, physiological variation in hemoglobin occurs. या फिर डायरनल वेरिएशन आता. डायरनल वेरिएशन का मतलब है मॉर्निंग एंड इवनिंग में डिफरेंस आता. डायर्नल वेरिएशन, ठीक है, सुबह में जनरली हेमोग्लोबिन का कॉन्सेंट्रेशन बहुत हाई रहता. As you go into evening the concentration will decrease slightly. Also, if someone is going to a higher altitude, ठीक है, hemoglobin amount generally increases. Compensatory mechanism, because the patient will have decreased amount of oxygen being supplied. अगर आप higher altitude को गए तो total amount of oxygen that is available to you will decrease. So the production of hemoglobin in your body will increase. ठीक है, higher altitude generally translates to higher amount of hemoglobin in the person. Okay, at that point of time at least. Now there are a few conditions in which there will be a false increase in hemoglobin. Okay, so conditions where HB is falsely raised. Okay, now these conditions will include burns या dehydration, severe dehydration or a, okay, burns, severe dehydration. Okay, इसमें क्या होता है, हीमोग्लोबिन लेवल रिलेटिवली बढ़ जाता। फॉर एग्जाम्पल लेट सपोज अब मैं 4.5 लीटर्स का ब्लड लिया, आई हैव अ पर्सन हु नॉर्मली हैड 4.5 लीटर्स ऑफ ब्लड, ठीक है। इन देम देर इज सिवियर डिहाइड्रेशन या फिर बर्न्स हुआ, ये वॉल्यूम अगर कम हो गया समझो, लेट सपोज नाउ द वॉल्यूम इज 4 लीटर्स, ठीक है, हाफ अ लीटर इज गॉन फॉर एग्जाम्पल, ठीक है, 4 लीटर्स हो गया। अब हीमोग्लोबिन अमाउंट जितना इसमें था इसमें भी उतना ही रहता, बट द रिलेटिव अमाउंट ऑफ हीमोग्लोबिन इज टेक्निकली हायर इन दिस, ठीक है। अब 4.5 लीटर, you're basically concentrating the solution, 4.5 liters of blood में there was a certain amount of hemoglobin in that patient. If because of dehydration or because of severe dehydration or because of burns, ठीक है, सेकेंड डिग्री और थर्ड डिग्री बर्न्स, उसके अंदर वॉल्यूम ऑफ ब्लड अगर कम हो गया, या तो हेमरेज से हो रहा, या हेमरेज इज ऑल्सो अनदर फैक्टर, ठीक है। इफ देर इज इमीडिएटली आफ्टर एक्यूट हेमरेज, दिस वैल्यू विल चेंज। acute hemorrhage होने के बाद क्या होता, a lot of plasma is lost, because of which relative amount of concentration of hemoglobin increases, the same that occurs in dehydration or that occurs in burns, ठीक है। या फिर if blood is taken during intravenous infusion, या especially intravenous infusion of iron containing drugs, ठीक है, in that case also hemoglobin will relatively increase. Then there are conditions in which disproportionate anemia will occur or false anemia will occur, ठीक है। these are conditions in which hemoglobin is raising, ठीक है, बर्न्स में या acute hemorrhage में या severe dehydration में, या फिर आप ट्रांसफ्यूजन इन्फ्यूजन ले रहे, इंट्रावेनस इन्फ्यूजन ऑफ ब्लड ले रहे, या प्लाज्मा का इंट्रावेनस इन्फ्यूजन ले रहे, जब आप बढ़ जाता, when you see anemia is false anemia, okay, so the conditions in which you see false anemia, one is pregnancy, ठीक है। Generally what happens is there is increased plasma volume, because of which the relative amount of hemoglobin tends to become lower. Technically it has not become lower, your blood has become more diluted, ठीक है। प्लाज्मा वॉल्यूम इंक्रीज हो जा रहा प्रेगनेंसी में, अगर प्लाज्मा वॉल्यूम इंक्रीज हो गया बोले तो हीमोग्लोबिन अमाउंट विल जनरली डिप डाउन 1 to 2 ग्राम्स पर डेसीलीटर कम हो जाता। या फिर हाइपरवोलेमिया, सो वन इज प्रेगनेंसी, ब्लड डाइल्यूट कर रहे हैं बेसिकली आप, या फिर हाइपरवोलेमिया, इंक्रीज्ड अमाउंट ऑफ वॉल्यूम ऑफ ब्लड, ठीक है, इधर बिकॉज ऑफ कोई भी कंडीशन, लेट सपोज योर किडनीज आर नॉट वर्किंग प्रॉपर्ली, और इफ देयर इज हाई अमाउंट ऑफ कॉर्टिसोल और देयर इज हाई अमाउंट ऑफ एल्डोस्टेरॉन, ठीक है, causing retention of fluid that can cause hypervolemia leading to false anemia, ठीक है। it will appear as if the amount of hemoglobin has decreased in the person, but it has not changed, it is just that the volume of blood has increased, ठीक है। स्पेशली अगर रीनल फेलियर हो रहा, ठीक है, अगर रीनल फेलियर हो रहा, जब दोनों भी हो सकते हैं, अगर पेशेंट हैज रीनल फेलियर, sometimes as a compensatory mechanism polycythemia will also occur, increased amount of synthesis of red cells and increased synthesis of basically red cells, rbc production बढ़ जाता, and red cell blood components बढ़ जाते, ठीक है। as a compensatory mechanism sometimes false report आ सकता, anemia है या polycythemia है। Now there are a few diseased conditions in which hemoglobin increases as well, ठीक है, the patient has a proper disease altogether, these are just physiological conditions. There are diseased conditions, diseases with increased hemoglobin, where hemoglobin increases, या आपके COPD में increase हो जाता, ठीक है। ब्रीदिंग प्रॉब्लम है तो कॉम्पनसेशन में आपका बॉडी विल स्टार्ट प्रोड्यूसिंग मोर अमाउंट ऑफ हेमोग्लोबिन। या फिर साइनोटिक डिजीज है, साइनोटिक डिजीज ऑफ हार्ट, कंजेनाइटल साइनोटिक डिजीज ऑफ हार्ट, वन सेकेंड, कंजेनाइटल congenital cyanotic disease of heart, this will relate to cellular respiration that is interfered with, या फिर the patient has Cushing's, ठीक है, Cushing syndrome, Cushing syndrome is when cortisol production is extremely high, ठीक है। या फिर फियोक्रोमोसाइटोमा, दोनों भी सिमिलर है, हाँ, कुशिंग सिंड्रोम रहने दो या फियोक्रोमोसाइटोमा। Pheochromocytoma is a tumor that is occurring on the adrenal gland. adrenal glands are responsible for production of cortisol. तो कुशिंग्स रहने दो या फियोक्रोमोसाइटोमा रहने दो, दोनों में भी cortisol production increase हो जाता. Whenever Cushing's or pheochromocytoma occurs, the patient generally has polycythemia as a manifestation. ठीक है? That is why you will see increased amount of hemoglobin. Cythemia as uh, primary or secondary manifestation. ठीक है? या फिर the patient is having renal cell carcinoma. Renal cell carcinoma में generally क्या होता? There is ectopic secretion of erythropoietin because of which hemoglobin amount increases. Renal cell carcinoma. Sometimes in smokers as well. ठीक है? Due to carboxyhemoglobin occurring or carboxyhemoglobin being present in your blood for a very long period of time and at a very high concentration, smokers generally have a compensation of polycythemia. So smoker polycythemia. ठीक है? In all of these conditions, these are diseased conditions in which the patient will have increased amount of hemoglobin. Now as such आप red cells या white cells या platelets जो count करते, there are two main ways through which you can count the amount of red blood cells that are present. So you can use either a visual hemocytometer या फिर you can use an electronic method. I'm not sure आप लोगों को practical में कराए नहीं कराए, but there are two main methods. ठीक है? एक तो visual hemocytometer रहता. So you have visual hemocytometer. ठीक है? And electronic method. Now let's suppose you are counting RBC using visual hemocytometer. इसमें क्या करते हैं आप? You will take a little bit of blood and you will dilute that blood. The dilution is around 1 to 200. ठीक है? ठीक है? You will dilute it 200 times. You will use some isotonic material. ठीक है? You can use saline and you can use any other isotonic fluid to dilute blood 200 times. ठीक है? And this diluent इसलिए आप dilute कर रहे हैं so that you can prevent clotting from occurring or clumping from occurring or Rollo reaction from occurring. Rollo reaction is basically when RBCs will clump together or they will stack together. ठीक है? रोलो फॉर्मेशन बोलते हैं उसको. ठीक है? This is when RBCs will literally stack and make a cylinder together. So they will get stacked like this. अगर and proper anticoagulant नहीं रहा, they will clump together ऐसा. To avoid this, you will what you call dilute the blood, and so that WBCs are not destroyed. That is also one of the reasons why you are diluting the blood. Now what you do is you will put it on a tray. आप कभी you can see the video on YouTube if you want to. You will put it on a tray. You will, because you are diluting it 1 to 200 times, you will put it under a electronic microscope and you will literally count the number of what you call RBCs that are present. This method is not used as much nowadays because it takes a very long period of time. आप dilute करने के बाद कैसा रहता बोले तो ऐसी ट्रे रहती, वो ट्रे में छोटे छोटे वेल्स रहते. ठीक है? इफ यू रिमेंबर एलिसा करे जब ऐसा एक ट्रे यूज करे थे ना, सिमिलरली वैसी एक ट्रे लेते, उसमें यू पुट ब्लड, लिटिल बिट ऑफ ब्लड विच हैज बीन डाइल्यूटेड 200 टाइम्स. ठीक है? नाउ व्हाट यू डू इज इन दैट ब्लड यू विल फिजिकली काउंट द नंबर ऑफ आरबीसीस. ठीक है? यू विल टेक अ पेन एंड पेपर, यू विल कीप ऑन काउंटिंग. But the measured method generally takes a very long amount of time, because even if you count one of them, it will take enough amount of time and you are multiplying it several times, and there is an error factor where this particular well might have more number of cells than this particular well. Another way to overcome that is counting all of the wells, but it will take a long time. एक patient को कितनी देर करते? That is why electronic method is used. Now electronic method में आप क्या करते? You take anticoagulated blood, ठीक है, and you add anticoagulant to that blood so that it does not coagulate, and you dilute it with a diluting material. Generally saline is used. After that you put it in a machine and that machine will count the number of cells for you. Okay? The diluent is again added for the same reason. You're adding so that it does not clump or it does not clot or it does not form rollos. All right. Now, generally speaking, you will see decreased RBC count in case of anemia, and you will see increased RBC count for polycythemia. Now, similarly, you will use a similar method for WBC and for platelets. You will use same visual Heber cytometer, and you will use an electronic method. Same वैसे ही follow कर सकते हैं. कभी कभी diluent जरा change होता, and अगर आप WBC के लिए कर रहे हैं, let's suppose, especially in case of visual method, in either cases, अगर let's suppose आप WBC के लिए कर रहे हैं, in this case what you will do is, in RBC you did not destroy the WBC, right? In count, while counting WBC you will add a lysate, you will add a lysis material, उसको lysate बोलते हैं. You will have different types of lysate chemicals रहते हैं वो, that will destroy specifically RBC, so that you can peacefully count the number of WBCs. ठीक है. हाँ, technically speaking they are RBCs both रहते हैं, and you can distinctly difference, you can see the difference between them and WBCs, but when you are counting WBC, RBC number both interfere करता. So what you do is you add a little bit of lysate so that it can destroy all of the RBCs, and you can easily count WBCs. All right. Electronic method में भी वही करते हैं आप. You will use a light scattering technology. You will put it into a machine, and that machine will count the number of WBCs that are present. अगर increased amount of WBCs है तो cytosis बोलते हैं. So it will be leukocytosis. अगर decreased है तो leukocytopenia. Cytopenia. ठीक है. Same for the other case as well. अगर platelets है, the platelets are technically not exactly cells. Okay, they are how should I put it? They are strands of fibrin. Okay, they're not technically pure cells as such. Now, in any case, if they are very important for blood coagulation, obviously you will use a similar method. You use visual method and electronic method, but at your level you don't have the details about it. थोड़ा change होता, because platelets do not act like normal cells. Okay, they will clump very easily together, and they generally travel in packs altogether. ठीक है, उसका counting भी थोड़ा अलग होता. Now, again, depending on the condition, if the patient has, let's suppose, increased amount of platelets, they will generally have clotting problems. Clotting problems in the sense that they will have increased coagulability. Blood clots will form very, very easily in them. वो condition को thrombocytosis बोलते हैं. अगर कम platelets है तो thrombocytopenia. Same like leukocytes. ठीक है. Now, there are several conditions that will cause thrombocytopenia or thrombocytosis. We'll discuss about the conditions that are causing thrombocytosis and cytopenia tomorrow. All right. ये पूरा clinical pathology chapter is very easy. It is just number of tests, cross matching, things like that. Okay. I'm sure you must have come across these basics at some point or the other. Anyway, brush them up a little bit. ठीक है. Okay, चलो.